Over the festive season, it's become a familiar sight. Thousands of Australians spending hours waiting in line for a COVID test.
It's our off time, everyone's trying to get tested, people are getting their tests late, delays.
We thought it would have been quicker today, so it's a pretty long time, we're still waiting.
Sophisticated PCR tests have been at the front line of the nation's response since the start of the pandemic. While the tests are highly accurate, they need to be processed in a pathology lab. Under the strain of 2.6 million tests since Christmas Eve, test result waiting times are blowing out. To ease that pressure, governments are advocating rapid antigen tests, which are less accurate but provide a result within minutes. But they are becoming harder to find.
Everywhere I went, from Chemist Warehouse to Woolies to Priceline, completely out of stock.
Yasmin Poole suspected she was COVID positive and spent hours trying to track down a take-home test.
Thankfully, we had a friend that had found some in the opposite end of Melbourne, so we kind of met on the train to almost exchange these rapid antigen tests, which isn't great if we're already symptomatic and having to hop on a train and do that, but we honestly had no other choice.
She later managed to buy 4 tests, which cost $80. Only 3 of them worked.
The rollout of the rapid antigen tests has been a complete mess. They didn't order enough, they're charging for them. We ought to be encouraging this, not discouraging it. We ought to be encouraging no financial barriers. In the United Kingdom, if you want, you can log online and get the NHS to send you 7 rapid antigen tests in the mail.
Last week, the Prime Minister rejected calls for the federal government to make the tests available free of charge.
For all other casual uses, you just think you'd like to get a test or something like that, well, that's what the private market is for. We believe, based on the advice we've had from the industry, they can go and they can make those plans and we can get them back on the shelves and we can get on with it.
It is unbelievable that the government has told people to not go and get tested, but to test themselves with a rapid antigen test that isn't available and that isn't affordable. This is a public policy failure, the like of which we haven't seen in this country before.
Both the Pharmacy Guild and major retailers like Chemist Warehouse say they did not lobby the government to prevent free tests.
Chemist Warehouse has at no time lobbied to prevent the provision of free rapid antigen tests to members of the public or vulnerable people.
Senior Executive Greg Turnbull says stock in New South Wales and Victoria is selling out as soon as it hits the shelves.
Chemist Warehouse stores do not have stock. It has sold out over the Christmas New Year period. At the moment, anything we've got into store has sold almost immediately.
Major pharmacy retailers have also blamed shortages on the number of truck drivers isolating due to COVID.
It only takes 1 or 2 truck drivers for a transport company to be a close contact or to report symptoms or a positive test, and next thing you know, those supplies are not available for the stores that are expecting them.
Rapid antigen tests are free in Germany, Singapore and the UK, and amid claims of exorbitant prices in Australia, the Prime Minister today again defended his decision to not make the tests free for everyone.
We're at another stage of this pandemic now where we just can't go round and make everything free.
There are bad apples in every market. In this case, I'm proud to say that Chemist Warehouse set a price for these products when they first became available to sell through pharmacies back in November, and Chemist Warehouse has not changed that price.
The people who can afford to pay and who want to pay will pay more, and so unscrupulous, price gouging chemists will actually have an opportunity, and they will use that opportunity in their own interest rather than the public interest.
Queensland, New South Wales and Victoria have ordered millions of tests with the intent on handing them out free of charge, but it's still unclear who will be eligible for them.
At the moment, we've got not a clue how many cases there are, because the only positives that are being recorded are those done in testing clinics on PCR, and people who test positive on rapid antigen tests are just not included in the numbers.
Can I have 3 boxes, thanks?
Dr Peter Lewis, who is importing and distributing rapid antigen tests to retailers, says the government's messaging is confusing.
It makes it hard to plan production and distribution. It really does.
Dr Lewis says he actually has stock waiting, ready to distribute to retailers.
There really hasn't been any communication at all. I've actually reached out.
Almost 2 years into the pandemic, history could be repeating itself.
I've certainly thought of the rapid antigen market as resembling toilet rolls and the panic buying, and I think we are seeing that. People are aware that there's a shortage and they want to stockpile.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.